Is this Dr. Amanda Graham?
Yes, it is. Good morning.
Good morning. I'm glad to be speaking with you today. I
Likewise.
understand, I understand that you're Senior Vice President of Innovations at the Initiative and also Adjunct Professor of Oncology at Georgetown University Medical Center.
Yes, I am.
Okay, so we're going to be talking this morning about BecomeAnEx, correct?
Yes.
All right, what is BecomeAnEx?
BecomeAnEx is a free quit smoking program that has helped over 800,000 smokers on their quitting journey since we launched the website almost 10 years ago. We developed the program in collaboration with experts at the Mayo Clinic Nicotine Dependence Center, basically taking proven quit smoking treatment strategies and making them available on any kind of computer or mobile phone. I'll give you the web address before I forget. It's BecomeAnEx.org.
BecomeAnEx. Give me the .org. Okay.
Yep.
All right. I'm waiting.
Oh, okay. And so when you get to the website, what you'll find is a personalized quit plan that helps users really understand their personal smoking behavior, the things that are cravings and triggers for them, to help them sort through if medication would be right for them and how to use it. We provide extensive text messaging and email support, not just around a quit date, but for weeks and months afterwards, which is often when people need that support the most. And perhaps most unique to BecomeAnEx is our online community. We have a large support community of thousands of users who are active around the clock, 24/7, sharing their stories and advice, celebrating each other throughout their quitting journey, talking about lots of things that have nothing to do with smoking, but really supporting each other in the shared goal of living life free of tobacco.
Okay, and how effective is the program?
Yeah, that's a great question. There's really two answers to that question. BecomeAnEx has been at the center of a large federally funded research portfolio for the past 7 or 8 years, and our research has shown that smokers who follow the X plan have 4 times a greater chance of quitting than smokers who don't use any treatment. We know that most smokers tend to quit cold turkey, willpower, whatever you want to call it, but without any assistance. And this program basically increases their chances fourfold of quitting. Those are the numbers in terms of effectiveness. But really what we see in our online community are powerful testimonials from many members who tell us that getting involved with X has literally saved their lives. And so I think when we think about effectiveness, considering both of those equations is really important.
Okay, and what sort of tools are you using?
So the quit plan that I've talked about is really at the center of BecomeAnEx. Essentially what we've taken is research and clinical expertise that we've accumulated, that the public health community has accumulated over the past 30 to 40 years, and distilled it into interactive exercises and a self-guided website and program that users can use to create their own quitting plan. At BecomeAnEx, we believe there's no one right way to quit smoking. We present smokers with our best recommendations based on the scientific evidence and our clinical expertise, but we really aim to put smokers in the driver's seat to create a quit plan that's based on their experiences and their preferences. We know that most smokers make multiple quit attempts, and it's pretty common that people feel defeated or demoralized, like a previous quit attempt has been a failure. And what we emphasize is that each of those quit attempts is really a learning opportunity to better understand their addiction and how to overcome it, to put together a quit plan for their next quit attempt that's likely to be successful.
And how can employers help their employees who are trying to quit smoking?
Yeah, helping employees to quit is really one of the smartest investments that employers can make. We've developed a companion program called the X program specifically for employers and health plans to offer their members who use tobacco. The program provides smokers with additional premium services, and it also supports employers in implementing the program. We have a full suite of promotional materials. We work with employers to create engaging and compelling promotional campaigns throughout the year. We help them evaluate the results of the program and help them implement smoke-free workplace policies.
I see. That's interesting. And how does it benefit employers? Do you have any data on how the program works, the X program works for employers?
Well, we know that employers really bear the brunt of costs of smokers. There's some really compelling research that came out over the past several years that smokers, on average, cost an employer roughly $6,000 more than a non-smoker. And so the program is really designed to help them with the costs of smokers and also with retention. We know that people who quit smoking are more productive, they're happier, they're healthier, and they tend to stay with an employer longer term. And so there are a number of benefits, both in terms of healthcare cost savings, but also for an employer with recruiting and retaining top talent.
Okay, now let's go over the web address again for BecomeAnEx. It's actually Become, BecomeAnEx. Is that correct?
That's correct, .org.
.org. Okay. Well, your information has been very helpful. I'm sure my Health Power audience will appreciate the information, and some of them, of course, may very well become an ex-survivor.
Well, we hope so. We will look for them on our site.
Okay, very good. And have a good day, and it was good talking with you.
Likewise. Happy holidays.
Yes, same to you.
Thank you.